Why some sacral wounds never heal, even with good care. Some sacral wounds never heal, even when the care looks appropriate. Dressings are changed. Pressure is addressed. And yet, progress never comes. This is one of the most frustrating situations in wound care, doing everything that should work, and still seeing a wound stall. Appropriate care does not always equal effective healing, especially in chronic sacral wounds. The core problem. The reason many sacral wounds don't heal isn't because clinicians aren't trying hard enough, it's because chronic wounds don't behave like acute wounds. Acute wounds are predictable with linear healing, while chronic wounds usually have disrupted healing with stalled progression. Stalled and inflammation. Most non-healing sacral wounds are stuck in the inflammatory phase. Persistent inflammatory mediators delay repair. Local barriers to healing. In the sacral area, local factors play a major role in delayed healing. Some of these local barriers include pressure and shear, excess moisture, recurrent contamination, necrotic burden. These factors keep the wound in persistent inflammation. Pressure is more than offloading. Pressure isn't just about turning schedules. Micromovement, shear, and prolonged sitting can continue to injure tissue even when repositioning appears adequate. Systemic factors often miss. Even with excellent local care, systemic factors can quietly prevent healing. Some of the systemic contributors that prevent healing include diabetes and poor glycemic control, malnutrition, steroids, immunosuppression, advanced age, and poor perfusion. Biofilm and occult infection. Many sacral wounds fail because of unrecognized biofilm or subtle infection, not dramatic signs, but enough to stall healing. Biofilm maintains inflammation with minimal visible signs, delayed granulation, and recurrent breakdown. Why dressings alone don't fix it? Changing dressings doesn't change the wound environment if the underlying problem isn't addressed. Keep in mind that dressings support healing, they don't create it, so your strategy matters more than the product you use. How experienced clinicians think differently. When a sacral wound doesn't progress, experienced clinicians stop asking, "What dressing should I use?" and start asking, "What is preventing this wound from moving forward?" Ask yourself, what phase is this wound stuck in? What is sustaining inflammation? Key takeaway. A non-healing sacral wound is not a failure of care, it's a signal that something deeper needs to be addressed. This clinical framework, how to recognize stalled healing and decide what to change, is organized in my Advanced Wound Care Guide for Clinicians. The link is below.